Boys, are you noticing changes in your body? Don't worry, these are normal. It's called puberty. You may notice more hair in places hair wasn't before, changing smells that often stink, that's called body odor, deepening of the voice, height and weight changes and increases, change in mood and thoughts, and erections. All is normal, all is good. If you have pain or worry, always seek help.
Major changes occur in the body during puberty. Generally, the first sign of puberty in females is breast growth. Breast buds will develop under the nipple and may produce an itchy or tender feeling. They will continue to grow slowly as time goes on, sometimes at different rates, which is perfectly normal. Secondly, hair might start growing more in various places of the body, specifically the armpits and pubic regions. During this time, females will start menstruation or their period. The first period a female has is called menarche. Prior to menarche, females may or may not start to experience cramps or vaginal discharge. It is important to note that puberty in females manifests differently and at different rates for everyone.
From the very first day you start menstruation, your body signifies that it is ready to become pregnant. And without male sperm, your uterus sheds its lining to signify that you are not pregnant. And this is what menstruation is. Some people have regular monthly periods, others may have irregular and unpredictable periods. But 3 products you can use during this time include tampons, pads, and menstruation cups. Now remember, it's always a good idea to keep these products on you at all times, just in case you get an unexpected visit by your period. You can also use heating pads, ibuprofen or Tylenol, and calcium supplements for the pain that you may experience. But remember, everyone experiences menstruation differently. Some girls may experience heavy and painful bleeding, while others don't. Some periods may not last a full 7 days, and that's okay. Menstruation is a normal biological process, so don't be afraid to talk about it, girls.
Hygiene for both boys and girls. These are things to do every single day, if not more. Take a shower, wash your face, especially in this T-zone, brush your hair, brush your teeth, brush your tongue, floss, wear deodorant, and wear clean clothes. If shaving pubic hair is desired, always remember to shave or trim with the grain of the hair, and always ask a trusted adult, friend, or sibling for help if needed. Just for the girls, never share makeup. Always wipe front to back. Never use anything but unscented soap to wash the vagina. The vagina has a natural cleaning mechanism, and discharge is normal. For the guys, if you are uncircumcised, always remember to retract the foreskin, clean the area, and then put the skin back in its original position.
Boys, safe sex is not only up to your partner, you must also prevent any sexually transmitted infections as well. These STIs can be transmitted not only through vaginal or anal sex, but also oral sex and possibly even kissing. Before attempting a sexual act with another person, discuss past partner history and STI history. Ensure that consent has been explicitly implied and the other person is comfortable. There are a few ways to prevent STIs, and that includes abstaining from sex, wearing a condom, if your partner is female, ask if they are on birth control, and remaining monogamous with said partner.
Girls, don't be scared to protect yourself during sex. The risk of pregnancy and STIs are very real and a major concern for your health. If you want to start having sex, talk to your parents or doctor about getting placed on birth control. There are a variety of options for you, including daily pills, monthly shots, a small implant in your arm, and a tiny device that stays in your uterus. But there can be a wide range of side effects with these, so if you get started on one that makes you feel bad, please bring it up with your doctor. Also, it's incredibly important to remember birth control only protects against pregnancy, and it's not perfect at doing this, so make sure to use a condom every single time to protect you from STIs, as well as making sure you won't get pregnant.
Sexually transmitted infections. We're going to start off with bacterial infections, which can be cured with antibiotic treatment. First off, we have syphilis. Syphilis is characterized by small sores and a whole body rash. Next, we have gonorrhea. Males are going to experience swelling in one testicle and pus-like discharge, while females have increased vaginal discharge and bleeds between periods. Finally, we have chlamydia. Males are going to experience swelling in both testicles and have a white, cloudy, watery discharge, while females have heavier periods, pain during intercourse, and increased vaginal discharge. Viral infections. These cannot be cured, you can only treat the symptoms. First, we have herpes, which is characterized by small red bumps and white blisters in the genital area. Most importantly, we have HPV. This is mostly important because male can transmit the disease while still being asymptomatic, but they may develop warts just like the females. Females are going to have a high risk of developing cervical cancer while having the infection. I know this may be very concerning, but there are ways to prevent these diseases. You can practice safe sex by wearing condoms and limiting the amount of sexual partners you have. You can get vaccinated for HPV, or you can go ahead and get tested if you suspect you have any of these diseases.
Being a teenager is hard, but being a pregnant teenager is even harder. There are several myths and truths about conception and pregnancy. Did you know that the pill doesn't take effect immediately? Did you know that you can get pregnant even if it's your first time ever having sex? Did you know that you can even experience hair loss after having a baby? And did you know 1 out of 3 women have to have a C-section?
While there are a lot of truths out there about pregnancy, there are also a lot of myths going around that need debunked. One of those would be I'm breastfeeding, so I can't get pregnant. I don't need contraception because we only have sex during a safe time, and I won't get pregnant because I use a pull-out method. And lastly, the pill is effective immediately after taking it.